Good afternoon and welcome to our white coat ceremony. This is both a joyous and a solemn occasion. It's a proud occasion, so we're going to start on the pride side, and I'm going to ask all of the families out there, how many, hold up your hand if you fit this category, how many people think you are the proudest family in the whole room? Uh-oh, we seem to have a tie, so sorry, we'll have to move on. Now we're going to focus on our students, and you are taking a major passage from being a student to being a professional. And for today, I want to talk about some things that are going to stay the same and some things that are going to be different for you. The first thing in this passage that we've talked about before is the characteristics you will have as a graduate. And this goes way beyond now knowledge and technical things. I'm going to quote David Hume, and he says, "Reasoning does not cause people to act in certain ways. Moral judgments cause people to act in certain ways." So we will ask you to scrutinize your moral judgments when you're into patient care. So some of the things we talked about that are going to stay the same is what do we want to come out of this with? And we talked about characteristics like core of knowledge and basic and clinical dentistry. We talked about technical excellence, talked about critical thinking, talked about ethics and professional values for the trust of our patients and the public, talked about ability to manage a practice. We talked about social responsibility, and we talked about ability to function in a collegial professional setting. And that's really a shift. Now you're there. You've taken the step from being a student to being a professional. We also asked you at the very beginning 3 or 4 things about our whole culture. Number one was we asked everybody to work hard, right? You all know the curriculum is demanding, right? You got that? Okay. But we also ask you play on the team is one thing. We also ask you take care of each other, because almost everyone has some moment in the 4 years when they need some help, and we're here to help, and your friends are here to help, and your colleagues are here to help. And the last thing is do your best, do your best, do your best. And with that, I think we'll get through this. Here's some things that are going to be different now for you, and I think it centers around what I hear from some of our very best dental practitioners, some of whom are joining us here tonight. And I hear this over and over again, and they say focus on quality and service, service and quality, some variation of that theme. So it's focused on the patient. The next thing to keep in mind is that people will now put their health care in your hands. And that's an important duty that you now have that you didn't have before. Also, people will be scrutinizing you more closely than you can imagine. They'll be this far away. They'll see everything about you. So when you get up in the morning and look in the mirror, remember, get as close to the mirror as you can. That's what your patients are going to see that next day. I just ask, treat your patients as you would want a loved one treated. And I think that will carry you an awfully long way. Privacy is another thing with patients. It's really respect for the patients. I think there are ways we share professional information, and there are ways we keep professional information very private. And again, it's a common sense thing. What would you want people talking about? Be very careful about talking on the elevator, in lunchrooms, and so on about patients. There are settings to do it and settings not to do it. You're good at reading books. We know that. I ask you begin more reading people. Another thing we ask you is we've got a phenomenal staff. We have over 250 staff. Half of them have been here 10 years, 80-some have been here 20 years. If you think I run the school, I need to tell you I don't. And it's a great lesson for when you get out and practice. Take care of these great people. They want you to succeed. They care about you. It's a two-way street. And now you'll be doing irreversible procedures, really for the first time, really very soon. And that's an interesting moment. So make sure you're ready. The faculty all take the responsibility to do this. And I think you'll find the patients in our building are both loyal and possessive. I need to remind you that people that come from all over Iowa for their care here, this is their university, this is their academic health center, this is their dental school, and these are their Hawkeyes. So I think you'll now find this is a very fulfilling time that you're about to get into. I know it'll be enjoyable, so let's get on with our program. I'm next going to introduce Professor Pete Damiano, who is internationally known for his work in the Public Policy Center and dental health care, and Pete will deliver the keynote address. Sir, thank you.
Thank you, David. And good evening, everyone. As you've just learned, the most important thing that you're going to be doing in the morning is going to be trimming your nose hairs. Other than that, how many of you on a scale of 1 to 5 for our group here, and you think about how much you knew what it meant to be a dentist when you applied and on your first day here? 5 being, I could do this. 1 being, it sounded like a good idea because I saw it, in the back of a matchbook or something like that. But how many of you say a 1? Okay. How many a 2? How many a 3? Okay. How many a 4? Okay. A couple family members, dentists perhaps, something like that. How many a 5? Okay. How much has that changed since that first day through this first year? A lot? A little bit? A lot? You think, right? This is where it's now going to change, right? This is the big change. What you were really, the reason most of you applied to dental school, and that whole idea, whether it's because I wanted to be my own boss, or I wanted to help people, or I wanted to be a part of healthcare, or some combination of all those things that almost everybody has been saying when they've been applying to dental school for the last 50 years or so. All of those things are true, right? But now it really does become true. And where you've been the most important person in your life, for many of you, up to this point, that now changes. The instant that you have a patient in the chair with you, that person has to become the most important person that exists to you. And that's a good thing. And it's a life-changing thing, and it's a little bit scary, but on the other hand, it's really one of those things that's very, very fulfilling. For those of you who have been involved with service work before, you all know that when you provide service, you get a whole lot more out of it than what you put in. And that's what healthcare and that's what dentistry is all about. And it's one of those things that's really, really important. And to me, this is when the fun part is really going to start. Not that, biochemistry and all those kinds of things aren't wonderful and great, and learning about the Krebs cycle and all of that is great. And it's really going to help you to be a good dentist. It really is. You may not know now, but it really is. Maybe. But no, it's a great thing. But now is when, again, this is really the fun part. You're dealing with people. You are going to be helping people. And you're going to be doing it in a way that's often going to be even more than what you're ever going to pick up. That's one of the things that us as faculty members and teachers, and those of you who maybe have taught some before, that you never really know how you've impacted those students. And that's one of the really hard things. And then occasionally some student will come back and say, hey, you really made a difference for me, or something like that. And you kind of have to hold that true. It's the same thing with a lot of your patients, but you get even more feedback. Some of it directly and some of it more indirectly, but you're going to have a really profound and positive impact on many people's lives. And it's not just because you gave them a nice, pretty smile. You're going to be impacting people's health, and you're going to be impacting not just their overall, their oral health, but their overall health. I see patients in our special care clinic I did for many, many years. Ms. Cunningham here and I work together collaboratively and have for a year or 3, seeing many special needs adult patients. And that's where you really do sort of see that impact, and how this person that's going through cancer, and you would think that's the most important thing in their life, but yet that idea of losing a tooth or some change in their oral health status is really a marker that they can tell that something is happening, either more positively if things are going well, or more negatively because whatever their disease state is actually affecting their oral health, and that becomes something that they can really tell. And when you see that, it's a real reminder of the impact and the importance that we can have as dentists and oral health professionals. I think often in dentistry, well, it's just the mouth, it's just a tooth. It's not that big a deal. No offense to any physician colleagues out there, but for most primary care providers, you think about what they're doing on a day-to-day basis. It's not life or death kinds of things either. They're dealing with a lot of things, people with colds, people with this, and they're doing a wonderful job, and all those things are really important. Many of those things are going to be what we consider self-limiting. most of what you're going to be dealing with, if it's not intervened, is only going to continue to get worse. And so whether it's a cavity that's going to continue to grow that can get into an abscess and have to be extracted, et cetera, or it's going to be periodontal disease that's going to have an impact on their diabetes and potentially on low infant birth weight and some other kinds of systemic illnesses, don't ever sort of play yourself down in terms of like it's not that important. It is important. It's really important to you, it's important to your patients, and it's important to their overall health. And it isn't pitting, again, one type of healthcare provider against the other. There's this whole discussion about interprofessional, both education, but interprofessional practice. So as Dean Johnson mentioned, in the policy world, what I look at things about healthcare reform, and that can be either the financing side about health insurance and some of the things that you hear a lot, a discussion about in the media, or what's even much more important is how do we practice collaboratively so that when you have a patient, got a call today from a patient. He lives in Southern Illinois now, comes back and forth for his dental care. We've got a number of those patients who will do that. He was going through to have shoulder surgery, had to have his oral health taken care of. We were talking about, he sent me a copy of this x-ray from this dentist down there about a tooth and whether it needed to be extracted or not. And the more that we can move as a system and collaboratively having electronic health records that talk to each other and more direct communication, and it's not just co-locating in the same building, it's actually working together to provide the health care and improve the health of the patients together. And that's something that the world you're moving into. And that's a big change on the healthcare delivery system side. There's financing changes, we won't go into all of that, but that's really encouraging this integration, this reaching out. So instead of just waiting for patients to come in and see you when they're sick, actually reaching out to identify them before they get sick and come in. Prevention obviously is something that's not new, but how we do it, particularly with really high cost, high utilizing patients with multiple chronic health conditions, and the role that dentistry and oral health can play in that becomes really, really important. And that's an exciting world that you're going to be coming into that's going to be a little bit different than what we are. Technology is a part of that, but then there's also just the communication and getting to know them. You'll start by learning about what other healthcare providers do, but it's, again, much, much more than that. It's how do you work together to improve the health of those people. A lot of what I do is health policy research, and we try to provide unbiased information to policymakers and the public so that we can make better decisions. And that's what you're going to be doing as well with your patients. Many of you will be general dentists and primary care providers. You're going to be there to help them sort out that information as they get overloaded from different sources, whether it's on the internet that they're looking stuff up, and if you haven't yet, but as soon as you get in, it could be your first patient, somebody's going to come in and bring something to you and ask you, is this good or not? So understanding what the evidence base is behind what you're doing, being able to sort out that information and be that navigator for your patient, whether it's to other specialists or with information, that's something that's going to be critically important and a role that you're going to be able to play. And obviously doing that in an unbiased way and doing that with what's in the best interest of your patient, not necessarily in what's in the best interest of your pocketbook. In the long run, I truly believe that by doing what's in the best interest of your patient, it is also what's in the best interest of your pocketbook. But if you just do it because it's a more expensive procedure, not suggesting any of you would ever do that, of course. But to really just think about what now is the best interest of your patient, and that will be the best for you and your practice and everything else as you go forward. And that's critically important, I think, to be able to do that. So this gaining of clinical privileges really is a big deal. This is a life-changing thing. Again, don't want to make it seem beyond what it is, but it really aren't. This is something that's really critically important, is life-changing, is really cool. Right? This is fun. This is the part where you get to know other people, and you get to know your patients. And as Dean Johnson mentioned, the patients that come to the college are just unbelievable. That they'll sit there for 4 hours while you're cleaning their teeth where they could have gone somewhere else for 20 minutes. And it's not just people that do it because they can't afford it. We have something like a 25 or 30% of the patients that come to the college have private health insurance. They don't have to do this. They do it because they're investing themselves in you, and they want you to succeed. and they want to, again, that idea of service. They're helping you, makes them feel good. And that's something to obviously keep in mind as you're dealing with your patients. You're going to have patients who are going to drive for hours and hours to come and see you, to lay there for hours and put their trust in you. And this is the time for you to, flip that switch a little bit, and they become the most important thing. I have full confidence that you will all be able to do that. Graduates from the College of Dentistry, the faculty and the staff that you're going to be being mentored by, that's their number one focus. I've been at some other dental schools where it hasn't always been as much that way. And our graduates are very valued when they get out because of that. It's not just the clinical skills, it's the values that you're going to bring. So with that, I want to congratulate you, reinforce the fun that's going to be coming, and really do it with a smile. So thank you.
I'm going to go ahead and introduce your next 4 speakers. Dr. Alberto Gasparoni is representing the International College of Dentists. He's an associate professor in the Department of Oral Pathology, Radiology, and Medicine at the college. Dr. Daniel Kegler is representing the American College of Dentists. He's a 1975 graduate, and he practices in Independence, Iowa. Dr. Adam Fuller is representing the Pierre Fauchard Academy. He's a 2003 graduate, and he practices in Des Moines, Iowa. Dr. John Helstein is the president of the Omicron Kappa Upsilon, and he's professor and head of the Department of Oral Pathology, Radiology, and Medicine at the College of Dentistry.
Believe it or not, I am probably as excited as you are. This is my first time. Congratulations to all of you, excuse me, by the International College of Dentists, one of the largest associations. Really what I want to bring up, which has been already touched by Dean Johnson and Dr. Damiano, is that they value the same qualities that we do in the College of Dentistry, particularly when we select new applicants for the new cycle, which are honesty, integrity, leadership, and service. And I've been told to keep my talk very short, so I wanted just to share a couple of things with you. When I'm asked, what do we look in qualities in applicants that will make a good dentist, I always think about when I was doing my requirements in family dentistry. You will be there in about 3 years. And I saw one of my classmates back then walking down the hall with an elderly man, his legs bent by arthritis, and he was walking with a stick, and he was leaning on her, and she was helping him to walk to the front desk to schedule his appointment. And I think, I have no doubt, you will all become excellent clinicians. You will be all brilliant in your studies, and will be academically excellent. But I want also to remind you that we are there to serve our patients, our community. And I'm looking forward to work with all of you in the clinics, and good luck and the fun in the clinics.
Good evening. Unlike some of my counterparts, I am not nearly smart enough to do this without notes, so bear with me. My name is Dan Kegler. I am a past president of the Iowa Dental Association and chair of the Iowa section of the American College of Dentists, one of the sponsors for this ceremony. As Penny said, I am a graduate of the College of Dentistry and practice in Independence in a group setting with my son and a partner of 30-plus years. We are all Iowa graduates. The white coat you're about to receive is symbolic of your transition into patient care and clinical practice. It is a visible sign that you are moving forward in your quest to become a dental professional. Dentistry is a multidimensional profession which will allow you to express your creativity in many different ways. It will call upon you for critical thinking and sometimes difficult judgments. As you begin working with patients, you will often find that some have different values than you. Try to empathize with their needs. The patient's interests must always come first, while maintaining a reasonable, ethical, and moral standard of care. When you show patients you care, you will gain their trust, respect, and loyalty. How good you become in developing your clinical skills and judgment in the ever-evolving clinical practice of dentistry will depend upon you. A simple question I ask myself over the years is, would I want this treatment for myself or my family? If you are honest with yourself, you will always do the right thing. The American College has provided each of you with an ethics handbook for dentists and a card with the ACD tests for ethical decisions. This will be an excellent guide for you as you proceed into the clinical phase of your education. Use it to help you through difficult situations. Always know your limits, and remember, in the end, what you really want is what is best for the patient. In closing, you have a tremendous academic environment. You have access to a world-class faculty and an opportunity to graduate from one of the best dental schools in the nation. Take advantage of the knowledge of your instructors to guide you through the tough decisions. Don't ever be afraid to use them, because I can tell you more often than not, they will have a shared experience. And when you finish your formal education, whether you go into private practice, a group practice, a residency program, the military, or corporate dentistry, always remember to serve your patients to the best of your ability, both clinically and ethically. Use the foundation you receive at the College of Dentistry to find your vision of the future. Set goals for yourself that are attainable and move towards them. And prepare yourself to make the right decisions every day in your treatment of patients. And finally, as you progress through your careers, I encourage you to become involved in professional organizations. I can tell you from my heart, you will gain so much more than you give when you are involved. Thank you for your time, and congratulations on receiving your white coats this evening.
Well, I guess I can just throw this whole speech away because everybody has just talked about everything I was going to speak about. So I've got a couple stories. My name is Adam Fuller. I'm from Des Moines, graduate of University of Iowa. I represent the Pierre Fichard Academy, which exemplifies professionalism, integrity, and ethics in dentistry. And again, I would encourage everyone to join organized dentistry. It's very important to support the ADA, the IDA, or wherever you end up. And then your districts are very important to support. Two stories, true stories actually. The first is about my dad. I practiced with my dad. He was also a graduate of the University of Iowa about 30 years before me. And before gloves and masks were popular, they did what was called wet finger dentistry. And I don't know if I'd be a dentist in that era, but they talked earlier about personal hygiene and trimming nose hairs. And my dad was sitting down with a little 5-year-old patient, and the patient looked up and said, "Mister, you have a booger." And so that made my dad really self-conscious from then on. So we wear masks now. We don't have to worry about that so much. So second thing about being a professional, and I noticed that at a lot of our meetings we have, my rule of thumb is if I can mow my yard in what I'm wearing, I should not be wearing it to a professional meeting. So just think about that when you go to meetings. Don't look like you're going to go mow your yard. But a few other comments I have. You are transitioning. It's a big step. You're freshmen now, are actually going to be sophomores. You're starting, sophomore year for us is really hard. Lots of book work. I think we had 32 semester hours that year. So you still got a lot of book work, but you're transitioning more to that clinical side. So 2 decades of education, lots of bookwork, lab work, countless hours in chem labs, organic chemistry, lots of homework. Now that hard work is paid off and you're starting to reach that clinical side where it really is fun. It gets really nice. But in these last few years of your training, I want you to listen carefully to your instructors, learn from your patients because they'll teach you a lot of stuff. Learn all you can along the way and practice, practice, practice. Because in dentistry, it's not the perfection of dentistry, it's called the practice of dentistry. Thanks.
Hello. Tough acts to follow, obviously. I'm John Helstein. I'm chair of the Department of Oral Pathology, Radiology, and Medicine. We like the maxillofacials there too. But anyway, I'm also president of the Mu chapter of Omicron Kappa Upsilon. And I'd like to give you a brief overview of our group. Omicron Kappa Upsilon had its inception with the class of 1914 at Northwestern University Dental School. A committee from this group submitted a petition to the faculty of the school which stated that they were, quote, desirous of organizing and funding a national honor fraternity similar to other honorary fraternities now existing in leading universities, but which shall consist of dental students exclusively. Admission and membership to which shall be based upon scholarship and character as manifested by election of the faculty. Omicron Kappa Upsilon was to have as a standard for its membership certain ideals which are found in the preamble of its first constitution. It reads, to encourage and develop a spirit of emulation among students in dentistry and to recognize in an appropriate manner those who shall distinguish themselves by a high grade of scholarship. I would briefly like to impress upon you that what we expect of you are more than just minimum standards. The values that we stand for remind us of what it takes to complete training and accomplish our goals. They inspire us to do our very best at all times. Integrity is the willingness to do what is right even when no one is looking over your shoulder. Do your best at all times. Service, this is the norm, but remember to act in a certain knowledge that all persons possess fundamental worth as human beings. Excellence, as dental professionals, you are expected to develop and sustain a passion for continuous improvement and lifelong learning. Members inducted into OKU are scholastic standouts with unblemished moral and ethical character. The University of Iowa established its component chapter, the Mu chapter, in 1923 with a long, rich heritage. For myself personally and from the members of OKU, congratulations on receiving our clinical privileges and your white coat. The white coat is one which we'll be helping you get on in just a few seconds. I rotate up at the hospital and see the medical students, and they have their white coats and rotate up through every week. I can tell you, and I think he's maybe one of, if the dental school did this, maybe him, I don't know. By the 4th year, the medical students' white coats are quite a different color. It's always a guy. The women seem to know how to wash a white coat. And fortunately, next year, the white coat in dentistry will become a blue coat, and you'll throw it away every day in standard infection control manner and not wear it to clinic every day. But it will be new and bright, white and crisp, hopefully until the day you graduate. So anyway, and moms and parents out there, or wives and loved ones, if they do wear it mowing the grass, please don't let them do that. It just gets grass stains on it. So anyway, but it's a great honor. It is symbolic. it is something that you'll always cherish, and there's going to be lots of pictures of this white coat ceremony that you'll save for a long, long time. So thank you. You should be very proud.
I am Marsha Cunningham Ford, and I'm the course director of the course that helps us to be ready to go into clinic. And that is a privilege for me to do that, and my honor to recommend this class upon the recommendation of the faculty for clinical privileges within the College of Dentistry. Dean Johnson, I would like to request that this class be given clinical privileges to see the patients of the College of Dentistry.
Yes.
Thank you. We've been seeing each other as patients for a while now, and you might have heard some stories about how that's been going. And I know some of you are also going to be our patients here, and we appreciate that. It takes us a little while to do a procedure that gets done in private practice in a much quicker speed, but we've been seeing patients since January. And we are going to get faster at this. So I just want to let you know that if you are our patients, and I hope your student has told you that you would be here with us all afternoon to have this procedure done, cleaning and a basic preventive service, but they will get faster at this. And so I think to move to our white coats now, we need to get all of our players in position. So that would be Dr. Lee Johnson and Dr. Damiano on this side. And I'm going to ask the first two rows to stand, please, and make your way up and around over to where the white coats are. Nadine Altai. We can clap. Alexander Altoff. Guntas Bansi. Matthew Bieber. Aaron Blake. Tanner Brolsma. Caitlin Bussard. Abigail Carpenter. Alexandra Chamberlain. Frankie Chi. Jacob Dom. Kayla Davenport. Monica DiCarlo. Krista DeCorson. Hannah Grace Deary. Sean Desai. Niall Eckerman. Eric Eichwald. Callie Espanto. Will the next two rows please rise and come to the stage? Garrett Frazier. Mitchell Frericks. Abraham Freibler. Leighton Fritsch. Nicholas Gallus. Jaleel Jorbani. Nathan Goodson Gregg. Christina Helber. Lauren Halloran. Ellen Hart. Patricia Henderson. Jaden Holton. Carly Highland. Colleen Iverson. Isabella Jasek. Paige Jones. Jane Laporte. Ruchira Laroya. Aaron Lepek. Olivia Lofgren. Daniel Malloy. Amy Mace. Addison Miller. Patrick Minnick. Ryan Mooneyham. Emma Moldener. Dante Nesbitt. Ton Nguyen. Will the next two rows please rise and come to the stage? Bailey O'Brien. Kelly Auden. Colin Odland. James Park. Michael Parker. Austin Ritter. Matthew Rolfe. Shelby Rosehart. Logan Sarjensky. Austin Schmidt. Rebecca Schneider. Ryan Shaw. Jacqueline Smith. Hannah Serrata. Aliska Spilkey. Kate Steingraber. Sheldon Stender. Caitlin Stein. Erica Takanami. Stephen Thrapp. Nada Telmat. Hannah Turner. Travis Tuttle. Daniel Van Roekel. Craig Vidal. Austin Voves. Gunnar Vra. Bree Winiger. Brandon Winter. Adam Warnetsky. Flora Yen. Malachi Zietner. Rong Zhang. Congratulations. I'd like to ask the class to stand, and you can open your certificate, which has the oath of the dentist in it. Dr. Damiano is going to lead us in that oath in unison.
And just before we start, it says, I blank. That's where you say your name. Just to make sure that that's clear. I, Pete Damiano, as a member of the dental profession, shall keep this pledge and these stipulations. I understand and accept that my primary responsibility is to my patients, and I shall dedicate myself to render, to the best of my ability, the highest standard of oral health care and to maintain a relationship of respect and confidence. Therefore, let all come to me safe in the knowledge that their total health and well-being are my first considerations. I shall accept the responsibility that, as a professional, my competence rests on continuing the attainment of knowledge and skill in the arts and sciences of dentistry. I acknowledge my obligation to support and sustain the honor and integrity of the profession, and to conduct myself in all endeavors such that I shall merit the respect of patients, colleagues, and my community. I further commit myself to the betterment of my community for the benefit of all of our society. I shall faithfully observe the principle of ethics and code of professional conduct set forth by the profession. All this I pledge with pride in my commitment to the profession and the public it serves. Congratulations, and you're on a fantastic path that will lead you in directions you can't even imagine. Enjoy.
I'm going to ask the students to go down this hallway. Sorry. Yep, I'm going this way. We're going to meet, we're going this way, sorry, to meet with Ms. Penny Ryan, and we're going to get a picture on those stairs out there, and then the families can join us. Anything else, Ms. Ryan? Thank you. We're going to get a group picture, and then we can all join them. Let's let them get out first.